is a meta-analysis of approximately 90,000 patients who took statins for a period up to 4 years. And what it shows is that there is a small increase associated with statin use over this period of time. There was about a 9% increase in the risk of developing diabetes in patients who took statins. It didn't seem to be related to a particular statin, and it appears to be a class effect. I don't believe that clinical practice or prescription guidelines for statins will be changed by this study. The cardiovascular benefits of statin treatment, which are well documented not only for high-risk patients but now for lower-risk patients in primary prevention studies, is so well documented and, in my opinion, greatly outweighs this small increased risk of developing diabetes. I believe that more study is necessary. We don't have any idea about the cause of this relationship, if in fact it is real. It's still possible that it could be a chance effect, but it's consistent with a finding of a recently reported study I was involved in, the Jupiter study, which also reported an increase in the development of diabetes by the physicians who were following the patients in the study. What Jupiter did was to show that it's possible to identify a group of individuals on the basis of an elevated high sensitivity C-reactive protein. This is a measure of inflammation. And despite having a normal level of LDL cholesterol, less than 130, and no evidence of cardiovascular disease, no diabetes, these individuals had almost a 50% reduction in cardiovascular events in less than 2 years. And so, based on this results, the FDA has recently approved a new indication for rosuvastatin, the drug that was used in the study, so that for men and women who fit into a particular age category, men over 50, women over 60, who have an elevated CRP greater than 2 and one additional risk factor, the use of rosuvastatin 20 milligrams is indicated for treatment of these patients. Now, the FDA acknowledged a small increased risk of diabetes that may or may not be a chance occurrence, but even with this risk, the benefit of taking the statins far outweighs this small increase in risk of diabetes. Probably older individuals are at greater risk for developing diabetes. That's really about all we can say. There may be some relationship also with the stronger statins, but that's not really borne out. The only thing we can say at the moment is probably people who are more susceptible to develop diabetes, people who are overweight, and people who are older. We don't know what's causing the diabetes. There's been one study with statins that showed that one of the transporters of glucose into the cell, the so-called GLUT4 transporter, may be affected by statins, but we really don't have a good hypothesis at this time. Statins are being used in lower and lower risk populations. It's appropriate to study any potential side effects of the statins to make sure that we're doing more good than harm, and so far that certainly has been the case.